right, awesome. And so welcome back to our Health Innovators to Watch 2023. We have our new guest today with us, Monica Malta. This is our second podcast of a whole series. Hopefully we'll get all 15 of our Health Innovators to Watch for 2023. I'm one of your co-hosts, Dr. Candace Carpenter. I'm co-chief executive officer of the Boston Congress of Public Health, as well as chief strategy officer. And I'm here with my co-host. Take it away.
Hi. So I just want to introduce myself. My name is Dr. Circe Lecomte, and I'm co-CEO of BCPH with Dr. Candace. And I'm also co-editor-in-chief of HBHR Journal. I also lead BCPH's technical strategy, and I'm also running the BCPH studio. And it's such a pleasure to be here with you today, Monica. We so admire the work that you're doing and can't wait to hear more about it. In particular, the work you're doing with underserved trans persons in Brazil. We were quite alarmed by the statistics that you were discussing, and just really thankful that you're doing the work to address it. I know that you had some initial questions, Candace.
Yeah, so what we'll do is I'll do a brief introduction, Monica, but it will not do you justice. So then we'll allow you to go ahead and introduce yourself. So you're currently in Canada, but originally from Brazil. Is that correct?
Yes,
Awesome.
yes.
So you're assistant professor as well as scientist, a global health researcher, a human rights activist, a TEDx speaker, and you've done a number of things. But as Circe was mentioning, you've worked with different populations ranging from those who are HIV positive, individuals who use drugs, those who've been in sex work, as well as the LGBTQ community. But we'd love to hear your introduction, Monica, and a little just introduction into how you got into the work that you're doing now.
Yes, absolutely. So I am Brazilian. I was born and raised in Rio de Janeiro. That's a beautiful city, but a lot of people don't know that roughly 30% of the population live in slums, favelas,
Mhm.
lacking the most basic clean water and a safe environment to live. So I think that poverty and the huge impact of gender-based violence and gender inequalities while I was growing up pushed me to work with minorities, Latinx, the Black community, the LGBTQ community, and mostly those facing really hard poverty or food and housing insecurity. I think that's the key of my work. Yeah.
Absolutely. And I've never been to Brazil, but I'm curious. So you mentioned a number of different populations. So can you go into a little bit more about, you said, Black, Latinx, LGBTQ. What are the percentages of those in Brazil for those who happen to be from a different country besides Brazil and don't have an understanding of that kind of racial ethnic background?
Yeah, Brazil is very mixed. Most of
Mhm.
the population is mixed, um, Black. Most of us have, say, a grandmother or a father or a husband of someone who is Black, identify as Black or brown. So it's a very mixed population, but there is a lot of racism for sure. Systemic racism is, I think it's everywhere. No matter
Mhm.
where you live, there is a systemic, historic disenfranchising structure that impacts the health and the ability to have access to most basic education and healthcare support and so on and so forth. And it's not different in Brazil, even though it's a country that struggles a lot with access to healthcare and stuff like that. There is still a huge inequality. I think it's one of the most unequal countries where less than 1% holds most of the wealth, and the
Mhm.
vast majority is struggling to have meals on the table every day. So, yeah.
Mhm. Mhm.
Those are very striking things that you just said, and I was wondering if you could explain to the audience like some of the structures that are in place that reify and basically support these systemic inequities in terms of like the government, or if there's any historical sort of antecedents that led to the situation that it exists today, particularly in terms of racism as well as homophobia or transphobia.
Can I just jump in before you answer, Monica? So the podcast is designed for all kinds of people. We've used some terms that I think we might want to break down: systemic racism and structural racism. So, and homophobia and transphobia. If we could define things that are basic to all of us on this call, but may not be for other people, can we define those first and then answer Circe's question?
Absolutely. Yes, we've been talking a lot about systemic racism. I would define it as policies and practice that exist in society or inside specific organizations that resulting in a continuous unfair advantage to some people and unfair or harmful treatment of others based on their race and on their ethnicity. And that's a reality everywhere in the world. We see it in high-income countries, in low-income countries. We see it everywhere. No matter where you are, depending on your race and ethnicity, you might be treated different. You might have access to better care, better health service, or you might have a doctor that acknowledge your pain and give you treatment fast just because you look in a way, or you talk in a different way, or you have a different accent compared to other patients with the same complaints. And I think that's everywhere. US, Canada, Latin America, Africa, everywhere. We're going to face it to some degree. So there's another definition you asked? I don't know.
Yes, transphobia, homophobia, and then Circe, maybe you need to re-ask afterwards. Sorry.
Yep.
Yes. So the discrimination of LGBTQ plus people is also everywhere, and the more visible you are as being belonging to the queer community, you might experience different levels of discrimination, and we cannot put all together the lesbian, bisexual, transgender, gay man, in a sense that some of those who identify as queer might face additional discriminations and additional levels of unfair treatment, depending if they are, say, a Black and trans woman, or a Black trans woman who is also a sex worker. She is going to face a different treatment than a white cis gay man. And that's another key issue in the area that I work. Intersectionality is everywhere. So we all face some sort of gender inequality, but some of us might face additional struggles. Say, I am Latinx, I might face additional struggles because of my accent or my heritage. Dr. Carpenter might face other struggles because she is a Black woman, and so on and so forth. So even though we all have a lot of privileges, we are researchers, we are doctors, and we reach a lot in our professional lives. But when we are in the market, or when we are walking in the streets, when a Black man is jogging, it doesn't matter if he has a PhD or if he is on parole. He's going to be seen as a threat by many persons, and that's what is systemic racism. The ability of someone to go jogging in the morning is different for a white man, a Black man, for a white woman, a Black woman, a Latinx, and so on and so forth.
Thank you for sharing that. In terms of the practice or the structural inscribing of racism as well as homophobia and transphobia in Brazil. I was wondering if there were like specific sort of historical antecedents that folks would need to know, and if there was any like laws that were in place that you know em- emboldened and facilitated these types of prejudices and discrimination.
Well, I would say that Latin America, in general, is a very macho culture. Say there is a lot of stigma and discrimination towards um, anyone who identifies as queer, and there is a lot of violence towards this community. So Brazil, for instance, record at least one murder a day
Mm-hmm.
of LGBTQ plus person.
Mm-hmm.
There is no statistics on violence and discrimination. There is a lot of gender-based violence for sure. So within the queer community, we're gonna see more violence towards lesbian, bisexual, and transgender women than against a gay man. That's
Mm.
not to say that there is no violence against white gay men, but it's in a disproportional level, targeting specifically trans women and to a lesser extent lesbian and bisexual women. So you asked about legislations. Um, we were able to pass in 2019 key legislation that includes uh, violence against LGBTQ plus persons as a hate crime without parole. But that was a long, work that we did with the community, with the legislators to pass this law. We had a lot of data, a lot of information, a lot of advocacy in the background, and was passed in 2019 while we were having the as President Jair Bolsonaro, who was openly a person who shared a lot of hateful speech towards women, towards Black people, Indigenous people, and the queer population as well. So there was a big success in our work, but unfortunately, the legislation exists, but it's not reinforced on a daily basis. A lot of women, a lot of queer people are afraid to go to the police to report a crime because it's unfortunately very common for women and queer people to face discrimination and even violence in police departments. So that was why we started this innovation with an app to offer those who are facing discrimination and violence another way to report it, to have it informed to the police online, and to share with the community where is it unsafe, where say a restaurant or movie theater or a shopping mall that they experience racism or discrimination or violence. They can pinpoint that on the app, and all the community can include more information. It's like a crowdsourcing thing that everybody knows what happened, when it happened, and they can also include positive experiences. Say, I went to this specific healthcare facility and with this nurse, and I was really well treated. She acknowledged my problems, my concerns. She used the pronouns and so on and so forth, so they can pinpoint uh, good experiences as well and share with the community. So I think yeah, and it was asked for the community to have something like that. They wanted to have more information, not only on bad things that everybody know it's happening every day. They also wanted to know where it's safe for a Black queer woman to go and to be out with her lover, or to
Mm-hmm.
dress the way she wants, or to be safe. just to have fun or to look for treatment, testing, and so on and so forth.
Mhm. Awesome. I just wanted to ask some follow-up. So I noted that you've had about 10,000 plus users for the Rainbow Resistance app. And so what do you think are some of key strategies that you use to be able to get that many number of users? And then the second question would be, how do you think that being able to target those areas that are safe versus those that are violent, have you been able to transform, say, some of those violent areas because now you know where they are, so then you can have additional policies, policing, et cetera, in those areas?
Yes, I think that the queer community is highly connected everywhere in the world. We are on Instagram, TikTok, we are on Twitter. So I think that when the researcher, we work a lot with the community. We usually implement community-based participatory research. So before we start any intervention, we listen to them, we brainstorm with the community. How should we do? How should we find this population? Where should we go? And they told us social media. We are everywhere except Facebook. That's for old folks.
Yeah.
So I felt a little bit old because I still have a Facebook account. But anyways, that's how we started. We went to TikTok, to Twitter, to Instagram, and we have the app advertised there. We also had it in NGOs, in clinics, but I think the biggest chunk of those 12,000 people now, they came from maybe Instagram and TikTok, and of course word of the mouth. So someone was using and they showed to another one, and we kept working with the community from day one to so we changed it. We included new features. We changed the colors of the app, and I think that helped a lot. It was more accessible. It was more sustainable and uh, accepted by the community because they were there. They could include more comments. This feature is a little bit odd. I don't know how to use it, or maybe you should put a unicorn, and then we put the unicorn. And a lot of the trans folks, including teens, they liked it more than just a random rainbow. So I think that helps a lot when you are humble enough to listen to the community and not come with a closed packet. So yeah, we have 12,000 people using it
My gosh.
all over Brazil. There are folks who live in the Amazon Bay, where there is hardly no access to reliable health care facilities. They happen to be queer friendly, they are trained and so on and so forth, but they can connect with others. They might happen to be nearby, or they can share information, and they can access a lot of services within the app or on as telemedicine. So I think that helps a lot. I think we are in a new world nowadays. Public health needs to be informed and needs to be using all the innovations available, social media, 3D printing, apps, and so I mean, we passed this time that we are just in an office, a very neat and nice office, waiting for the patient to show up, because most of those who really need it, who really need the testing and the treatment, they are not going to show up. Maybe because they don't have childcare, maybe because they don't have money to pay for transportation, or they don't know they need a testing or treatment. Or in many other barriers that they might be facing. I think telemedicine is a jump in quality wherever you can offer it. It breaks a lot of those barriers that we face on a daily basis.
I was just wondering, you mentioned like folks from the Amazon even were using this app. I was interested in the technical side. Like, who helped you develop the app? Was this someone who donated their time, or did you get support to develop it?
Yes, we got support from Grand Challenges Canada and
Mm-hmm.
from NIMH to develop the app.
Mm-hmm.
We also got support from the Brazilian Parliament.
Mhm.
It was
Mm-hmm.
a support from John Willis. He was the first openly gay Brazilian Parliament, and then during the Bolsonaro administration, he had to leave Brazil because of death
Wow.
threats and that. But anyways, he helped us to develop the app. Each one donated money, and then we hired a lot of queer people to work with us, to work with the engineers
Mm-hmm.
developing the app, in a sense that we needed to hear from them. What are the features they need? How they want these features to work? And when we had the prototype, we sat with all those participants from the queer community in different regions of Brazil to listen to them and see if the questions were okay, if we need to change some wordings here and there, if the features were what they need, or if we need to include something or change something. I think that is another jump in quality when you work with the community, especially if it's a highly vulnerable population with specific needs that you might not be aware. Although I am a researcher working with queer people for a long time, I am not living in Brazil for a long time, and I'm not facing the same struggles, the same needs they are. So
Mm-hmm.
I think when you are open enough to allow them to work with you, that makes a lot of difference. It's the quality of the final product is way better, and it's what the community needs in the end. Yeah.
It's fascinating, and just the idea of um, engineers and the like working directly with the population that's going to be using what they create is so powerful, um, elegant yet powerful.
Mhm.
And
Mhm.
is the app still? It's available on through the app through Apple and Google stores.
It's available. It doesn't work if you're not in Brazil,
Yeah,
because we do have the maps and everything. They can
yeah,
the so, but you can download it just to
mm,
take a look on the app. Yeah,
yeah.
it's available. It became a government strategy. It's now supported by the Brazilian Ministry of Health. So now we are implementing new features because it's not only about violence.
Mhm.
This community, they face so many episodes of violence and discrimination over time that they do need a lot of mental health support. So now we are implementing new features that are going to offer screening for highly prevalent mental health disorders, anxiety, depression, suicidality, PTSD. And for those with a high score, they're going to be prompted to look for mental health professional, and a list of services that were identified by the queer community as queer friendly is going to pop to them. So hopefully that's going to help a little bit more, because mental health is a struggle in any population that you work with,
Mhm.
and the access to mental health services is another like key problem. There are not enough services available, especially in low and middle income countries, and those services available might not be friendly for the population depending on who you are working with. So having this background of the crowdsourcing might help us to show that there is this specific service nearby, and nurse X, Y, and Z, or social worker. Look for a social worker Monica or someone else, and she might be, yeah. So let's see how it works. We're implementing this feature and we're gonna test it. Hopefully by August, we're gonna start testing it.
Wow. Wow.
That's really fascinating. Like, so, from what I extract from what you're saying is like human-centered design, community participatory led, research and development as well. Monica, my next question is, I know it's just for Brazil, but do you see that this type of technology could be extended to other countries that have similar issues?
Absolutely. I think that more and more we are seeing in public health researchers in a lot of folks working with mobile health strategies. We do have a lot of apps available on any field that you look for. And our strategy is just one more in this big sea of strategies available. But yes, we've been contacting with other colleagues from Latin America. So if we get support, our next step will be to translate it to Spanish because it's all in Brazilian Portuguese, and we'll see how it goes. But yeah, it's open source. It's available, but it was designed by and for the queer community in Brazil. So if you're gonna use it anywhere else, you might need to start from the beginning and talk with the community and see if that's what queer folks in Canada or in the US or UK, you name it, that's what they need. Or maybe they already have some tools available. They might need something different.
If I may, unless you had any follow-up questions, Circe, I thought we'd kind of transition a little bit. So you're doing some other great work as well, Monica. So the Wikipedia edit-a-thons, as well as the Gauge with women and those who are gender diverse in STEM. Can you tell us more about those initiatives?
Sure. Those two initiatives is from an amazing group called 500 Women Scientists. That's an NGO that has groups working everywhere in the world, and the idea is to have more representation in STEM, science, technology, medicine, engineer, especially women of color and queer folks. So we do have a lot of strategies. The Gauge is a platform, a sort of a resource for journalists, educators, policymakers, and any other folk that is looking for expertise of women and gender diverse folks working in STEM. So you can include your name there. You can be on the platform, and those who are looking for a speaker, a keynote speaker, or someone to interview that is diverse, they can look into this open platform. And if you are a diverse folk in STEM, you can include your name there, and it's going to be available. So I think, yeah, this discussion is going on and on and on about the men panel and the white panel in many conferences. So I think that's where everything began. So how can we make sure that whoever is organizing a new conference can have a diverse panel? So we started with this small website, and it's growing steadily. So hopefully we're not going to see more conference with just white cis men speaking to a diverse audience, or so I think everybody can help a little bit in changing the way we know what is wrong. So what can we do after that?
That's incredibly powerful. And it really speaks to what we're trying to do here as well with BCPH to ensure that new and emerging public health leaders are supported. And what you described is very similar in kind, and cannot be, it can't be dismissed, that the power of ensuring that folks are represented at meetings, especially meetings that are about their health. Nothing for us without us. So yeah,
Yeah.
just was reflecting on the power of what you were saying. So,
Yeah. And piggybacking off what Cersei said as well, I think it really comes down to intentionality, because with everything that we create, our intention is always to have that representation across as many different ways. So not just race, ethnicity, gender, and sexuality, but in terms of geography, if we can go there, in terms of either able-bodied status or disabled-bodied status, intellectual diversity, industry diversity within, intersectional public health. So I was curious, for the Gauge, is that a free platform or is it a paid platform?
It's free.
It's free.
Yes. Yeah.
So audience members, if you're a female and a person of color within the gender diverse, sign up for Gauge. Monica's just
yes, please.
Yeah. So, and it's a beautiful website too.
Yeah, it's gauge.500womanscientists.org. So please sign up.
Excellent, excellent. And what is the kind of geographic representation? Like, is it fairly equal? Is it predominantly one country versus another, or how does it look right now?
Well, we do have a lot of folks from North America, and it's growing in Latin America and Africa. We do not have a lot of people from Europe and Asia so far, but it's growing steadily. Yeah.
Excellent. Yeah, no, I feel like it's one of those things, I just by, you mentioning it is something new. So it's a new discovery for me. So definitely something that we'll continue to share with all of our diverse people.
Awesome. Yeah, you asked for about another strategy from 500 Women, the Wikipedia Edathon. So Wikipedia is one of those websites that everybody looks like at least once a week or even more. It's one of the highly trafficked websites in the world, I would say. But unfortunately, roughly 19% of the English Wikipedia biographies are about women. So if you look on gender diversity, you're gonna end up with, I would say, 1%, even less. So this Wikipedia Edathon is another strategy from 500 women scientists. It's a free training that we have usually 2 times a year, and we train folks to edit or to start a new page. Usually we have, say, a specific training to include more Black women working in STEM, or broadly women working in STEM. We had one specifically for Black women and Black gender diversity folks last year. And the idea is that we create more pages, or if the page is already created, we include pictures or more information to make it more accessible. A lot of those pages about women in STEM and women in general do not have pictures, and whenever someone is Googling it, if it doesn't have a picture or if it's not interesting, they might not go there and open the page. So we try to improve the pages that are there. We created thousands of pages so far, have been viewed by billions of people, and hopefully it's going to improve the visibility of women in STEM and gender diversity folks in STEM. I think it's another strategy among so many that each and all of us can do to make the scientific world more friendly and diverse. To walk away of those empty statements that a lot of institutions put forward on the page, but when you look underneath DEI, and it's just a statement. There is not a lot going on there. So I think it's a social responsibility for us, being a minority, being a Latinx in STEM, being a queer woman. I think I'm trying to do my part, not only publishing and collecting data, but doing something else. Yeah.
Yeah, absolutely. No, I love the work that you're doing with that, Monica, and I agree. And I think Wikipedia is definitely, a start. And I think about just different ways to penetrate, national, international consciousness, right? Because it's not as if, women, LGBTQ people in STEM don't exist, right? Even though the numbers may be small, they nonetheless do exist. But it's interesting, being a Black female physician, how some people can still be taken aback because they're not expecting those things. And the ways that we do away with the fact that people are surprised is because they are able to see that representation within Wikipedia or other mediums.
Yes, exactly. We are here, so we need to show Google, Wikipedia, journalists, folks organizing conferences, and people like us, that we exist, and they have a place on the table. I think that makes a lot of difference for young kids to see a Black physician, a Black engineer, a queer folk with blue hair sitting on the table in a big conference, and you know so they belong. They can imagine that maybe in 10-15 years I might be in a conference delivering a speech with all my pieces and my colorful hair, and so yeah, we need this more than ever. We need diversity for sure. We need it, and each and all of us can do our part to make it more accessible. Yeah.
I think what I so admire about what you described just now is the elegance of, you don't need like a really expensive, intervention. Here you're talking about adding Wikipedia pages for folks who are, deserve to be found. And that's a very powerful thing to do, and that almost everyone can do. And it makes such a massive difference. And that representation is just that, it's representation. It means so much, and it's so inspiring to others to see themselves mirrored, and that they exist and deserve to exist in these spaces where for so long folks have been shut out. So thank you for doing what you're doing.
Sure. Yeah, I think that it makes the work of a scientist more fulfilling than just collect data and publish it and being read by other folks. I can do more. Despite against all odds, I'm here. I'm queer. I'm Latinx, and so others can come after me, and hopefully we're gonna have a science that is more colorful, more friendly, more welcoming than what we've been seeing in academia over all those years. So I hope for a better future for the new generation. Yeah.
I had a follow-up question to that. So it's interesting, right? You being in academia as well as research, and it's to a certain extent, one might say that you straddle different worlds, right? That of academia as well as activism. I'd like you to comment on that in terms of, how unique you feel you are in potentially straddling both worlds, if I'm getting it right. And then any kind of advice you would give to other academicians, scientists, researchers similar to yourself who may not feel that activism is necessarily their, province?
Yes, I think there is a lot of questions about it. If a scientist, if a professor belongs in the activism field.
Mm-hmm.
And to me, when you work with public health, with global health, somehow you are an activist. You might not be holding a poster, and marching, but you're writing about inequalities. You're writing
Mhm.
about lack of access to basic medicines, to insulin, to stuff that should be universal and accessible to everyone. Even in the US, it's a struggle to have basic medicines for folks that cannot afford it, and that's unbelievable. So for for those working in public health and in global health, I think activism comes in the package. You might use it in a very elegant and kind way on the discussions piece of your paper. You might go a little bit further. I am
Mhm.
very um, outspoken about it because I think my history
Yeah.
makes me who I am. I was raised and born in poverty, so
Mhm.
I don't feel like just publishing a paper. I need to do more. I need to do more for the Latinx community. I need to be there in the Congress, speaking with those who are developing those very unequal laws. Uh, but that's not for everybody. I know it takes a toll on yourself, on your mental health, and it takes time to to be on the parliament, to be talking with policymakers and doing interviews and stuff like that. It takes time. It might not be for other folks, but you can be an activist in
Mhm.
by developing Wikipedia pages or on your classroom, the way you address your students,
Mhm.
the examples you use. If you are putting slides, are you putting only white people? Are you
Mhm.
including a little bit of diversity on your examples? So I think there are many ways for you to be outspoken. Some of us are very outspoken, others a little bit more shy, but we can all make a difference no matter where we are. And I don't think that being a scientist means that you cannot be an activist. It's quite the opposite. We're seeing this on the global movement for those working with the environment and the global crisis. They need to be there. They need to be marching. They need to be making noise because, well, global warming is here, influencing infectious disease, malnourishment, poverty, and so on and so forth. So you cannot just collect the data and publish it. That'll be at least unethical. So depending on your field, you need a microphone to be very loud. Yeah.
Yeah.
I love that. And can I say something, Monica, just to be a bit challenging for anyone in the audience who may have this response, that to be a scientist, if you are doing activism in any way, that you're not being as objective. How would you answer that challenge that someone might toss out at you or other people who are straddling both worlds?
Well, I would say that 100% objective is impossible in science. I would say that. Um, in some fields, if you are working in a lab and analyzing atoms, molecules, it might be a little bit easier. But somehow, when you write a paper out of those outcomes from the lab, you didn't speak with anyone, you didn't collect any individual information or interview. But when you're writing it, you're putting yourself out there. So somehow your history, your background, your biases are there. the choices of words you are making on your introduction, the title of your paper, you are there.
Mhm.
So, and for other folks like myself working to address gender-based violence among LGBTQ plus persons, it's impossible to be, plain like a white paper. You have a history to tell
Mhm.
of folks who have been facing systemic racism for generations. So you cannot just write it down, the odds of facing violence. You need to go deeper. The history didn't start today when I did my survey or when I analyzed my cohort. It comes from generations of Black folks, Indigenous folks, Latinx that are experiencing a lot of struggles, and whatever we are facing now and whatever I am collecting with my data is not only a picture of those persons answering it, but it's a history of pain and inequity that their fathers and mothers, their grandmothers, and so on and so forth have been facing. And I cannot be just, plain. I need to put myself there. And being a Latinx and queer woman, um, everything I write, either on a blog or on a paper, it brings my history as well and my ancestrality and being someone who came from Brazil and went to the America and now to Canada. I have a history and my history is part of myself. So I am a scientist, but I am also a queer woman. I'm also someone who was born and raised into poverty. So all of those intentionalities are there when I choose the slides I'm going to present, when I select the examples I'm going to share with my students, the title of my paper, you name it. It's me, the scientist, the queer woman, the Latinx, the one who struggled with housing insecurity and food insecurity. It's all together, and all of us, we bring many faces to the table wherever we're talking, whatever we're doing. We're complex. We are very messy and complex human beings, no matter if you're a scientist or not. Yeah.
Yeah, I thank you so much for that. I think that's,
Sure.
beautiful and eloquently put. And yeah, I just wanted to throw that out there for, the veneer of objectivity that I think people like to put out. And I think you answered that so perfectly. So
It was perfect because no person, and certainly not science, is ahistorical or apolitical,
yes.
right?
Yes. Oh, so great. Love it.
Yeah. Um, and my
Yeah.
goodness, what a pleasure it is to talk with you. Thank you so
Yeah.
much for. I'm so glad that you saw the call for this award and that you applied, and we get to talk
Thank
with you. It's
you.
such a pleasure.
Yes. Thank you. Thank you
Yeah.
for having me. Yes.
Oh,
Absolutely. Thank you so much. Well, thank you to the audience for tuning in to this podcast, Health Innovators to Watch with Monica Malta. Feel free to check her out on bcph.org and connect with her on LinkedIn or other places that you might find her on social media. All of the wonderful work that she's doing in so many different communities across different continents, across different demographics as well. Thank you, Monica, so much.
Thank you
and
so much for the opportunity. Yes.
yes, and you're the link to gauge.500womenscientists.org. We will have it in the description for this video, and also it's in your profile that's on bcph.org. So
Yes. Sign in, please.
thank you.
Thank you
Awesome.
so much. Thank you.
All right.
Thank you.